Good afternoon, everyone, and welcome to the webinar, Leveraging Interoperability to Improve Patient Care. During this webinar, our presenters will share how pharmacists and physicians are leveraging interoperability to improve patient care, quality of care, workflows, and communication within care teams. We'd like to thank the sponsor of this webinar, Surescripts. Now let's go over some technical details before we begin. Those of you in our audience will be in listen and view only mode, but we encourage you to participate. Here's how. This will largely be a panel discussion. To participate, please enter your questions in the chat function and click send. We've saved some time near the end of the webinar to answer your questions. Should you need any assistance during the webinar, please don't hesitate to contact us via the chat function. Now it's my pleasure to introduce our moderator, Andrew Borgschulte, Principal Product Marketing Manager at Surescripts. Andrew, please take it away.
Great, thank you so much, Maria, and thank you all for joining us today. As Maria mentioned, I'm Andrew Borgschulte. I'm the Principal Product Marketing Manager here at Surescripts that covers our clinical history, medication history, and our clinical direct messaging solutions. So let's go ahead and get started and introduce the topic and introduce our panelists as well. So advancing interoperability is how we address healthcare's most pressing challenges, like doctors and nurses leaving their practice at alarming rates. Clinicians experience record high rates of burnout and aging patient populations with chronic conditions that need higher levels of clinical support. So in this webinar, we're going to explore how greater interoperability is enabling those physicians and pharmacists to do more of what they do best, provide lower cost, comprehensive care for their patients, no matter where they live. So to get things kicked off, I will turn it over here to my colleague, Justin, to introduce himself, as well as Alan, who's joining us from Carequality, and then we'll jump into the panel.
Yes, hello. Thank you, Andrew, and thanks everyone for being here. My name is Justin McMartin. I am a manager in our product management group here at Surescripts, and I focus in on this area of clinical interoperability with our products of clinical direct messaging, record locator and exchange, and care event notifications. I've spent 15 years in the health information technology industry doing various things of implementing electronic health records, working in policy areas, related to things like interoperability, and then also here at Surescripts developing and implementing our interoperability solutions. In addition to that work, obviously we get to work with a lot of great partners, one of them being Carequality, and we're very excited to have Alan here today, and other types of industry organizations like Direct Trust and other folks like that. So, but I'll hand it off to Alan to introduce himself now.
Sure, thanks, Justin, and glad to be here, everyone. I am Alan Swenson, the Executive Director of Carequality. I've been here for coming up on almost 2 years now at Carequality. Prior to that, I've spent a lot of time on the EHR side of things, the interoperability service provider side of things. My entire professional career has been in healthcare interoperability. And I was involved actually in the creation of Carequality and have been involved in it ever since. So jumped at the opportunity a couple years ago to take over as the executive director here. I've also, in that whole time, spent a lot of time with Justin and the Surescripts team. In fact, I was actually involved in my previous EHR role in helping with some of Surescripts' initial creation and testing of the National Record Locator Service, now Record Locator and Exchange, as it's continued to expand from there. So I definitely excited to continue to work with the Surescripts team as we roll out and improve nationwide interoperability.
Fantastic. So, all right, gentlemen. So for those in the audience today, we're going to take a minute to share how Surescripts and Carequality work together. And Alan, we'll start with you. So what does advancing or improving interoperability mean, both to the healthcare industry at large and to patients?
Yeah, that's a great question. When we look at the interoperability that's happening in the industry today, looking at even just Carequality from my perspective, which, is really only a portion of all of the exchange that actually happens. And for those that aren't familiar with Carequality is a framework that enables exchange of clinical information between disparate networks. And so, Surescripts does a whole lot of other exchange between their own customers. There are a number of vendor networks, HIEs, other national networks such as Commonwealth Health Exchange and others that all have exchange within their networks. And Carequality provides the connectivity for those networks to exchange between each other. At that level of the Carequality perspective, we're seeing roughly 400 million or 350 roughly million documents on a monthly basis. We had over 4 billion clinical documents exchanged in the 2022 calendar year. So that's a ton of information being exchanged. And that's all great. I think when we look at advancing interoperability, it's how do we make sure that that information is usable, is meaningful, is getting to the right person who needs to see the right information at the right time to improve patient care, whether that's a provider providing treatment, the patient themselves wanting to manage their care, public health has become more of a priority in the last couple of years, payer access to information. Making sure that information is easily accessible wherever it needs to go. And again, that it's meaningful and useful when it's received, so that the increase of information that we're seeing exchanged doesn't contribute to the provider burnout and things, Andrew, that you discussed. That we're improving that by making information access easier and more usable, and not overburdening and providing and contributing to that. And I think that's where we're going to see a lot of movement with continuing to advance interoperability, is in that usability of the information being exchanged.
Yeah, and if I could just jump in and build off of, I think what Alan said here is that it's taking the exchange that step further, right? Is what Alan's really describing, and in some cases that's going down to that use case level. Alan's talking about where providers need it, and we need to talk about, well, what is that provider doing exactly at that moment, right? Is it an emergency room doctor that's needing information quickly about what blood type the patient is, or otherwise? It's finding those ways to make that exchange more efficient, obviously, is critical to that. And just to share a little bit about the way we think about kind of network interoperability as a whole here at Surescripts, is that first you need to get information to exchange, and that's what Carequality has really created in this scenario, right? It's that shared foundation and understanding of how that information gets exchanged. And it's up for the networks like Surescripts and other implementers in that Carequality community, take it to that next level to say, how do we actually use that shared foundation to solve those unique problems, right? And as Alan said, that's something that Surescripts has been doing for many years, and we're very excited to continue to partner to do it in this space. And just as by way of thinking about all of the exchange that's happening in this world, we had over 21 billion transactions that were exchanged here through our Surescripts network in the last year. Or in 2022, I should say. And that's a really meaningful number and amount of data. But to all of what Alan and I are saying, we need to make sure that at each of those 21 billion points that we're doing everything we can to minimize the burden and the the interactions and other things that are unnecessary, so that everything works exactly as it should and everybody gets the right treatments when they should.
Yeah, absolutely. So, okay, so I want to move into a similar topic, but we're gonna shoot a little higher here. So, Justin, excuse me, sorry about that. What is the end goal for interoperability?
Yeah, shooting a little higher, huh? The end goal for interoperability, when we, I think, talk about it here at Surescripts, it's always a moving target. There's never going to be something else that we can't do to improve the data that's out there. And I think I'll call back to what I was just talking about in terms of kind of the network scale. The data has to get there first, right? Then we have to find the right use cases and ensure that they're being used in the right way in that world. And then you turn next to the quality of the information. It's not just, can I be able to support the transaction, put it in the right place in a provider's workflow or a healthcare organization's workflow, but how do I get down to that provider to patient care level where it's the highest quality, the most relevant data at all points in time. And if we can get to that place, we're obviously going to be in a very good place. But then there's going to be the next thing that we need to learn to exchange and to codify and to share as we look across it. So it's a very big question that you asked, but I think just thinking about it in terms of, what is success, it's ensuring that providers are able to give the care that they can in the most meaningful way to patients.
Yeah, absolutely. Alan, any thoughts you'd like to add on to that?
Yeah, I mean, absolutely. And just building off of Justin's last comment there, I think the difficulty of saying what's the end goal of interoperability is, if you were to get, 10 people who are directly involved in healthcare interoperability in a room and ask them what interoperability means, you'd probably get 10 different answers. And that they would certainly have things in common, right? But what interoperability really means is difficult to define. And it varies by person and what their needs are, what information they need, how they need to access it, and then you expand that and get some providers, patients, and payers all in the same room together and ask them what it is that they need, and you're going to get very different answers. And so that has always been difficult in determining, what is the end goal that we're even aiming at, to figure how close we are to achieving it. I guess, to me, I would say, the end goal of interoperability is the point at which the exchange of information is just how everyone expects that it works, rather than everyone being pleased when it happens, and treating it kind of like the exception of, wow, this information was here when I needed it. That was awesome. But rather when it's the expectation, and then we can stop talking about how are we going to get interoperability, because everyone just expects that interoperability is happening. Which then allows us to get into a lot of the other points that were discussed, where we can start focusing on, now that the information is easily accessible, how do we ensure that information is consistent and codified in a way that systems can easily use it, and it can get into proper workflows and help with decision support and help with all of these other things that we want the information to be used for. When we get to that point, I think interoperability, at least as far as the exchange of information, we've done it, and there will continue to be improvements and changes and new standards, and that's all going to be great. And behind the scenes, that the technical folks will continue to meet and talk about, while everyone else gets to then just focus on improving the use of the information that is easily available.
Alan, I often joke, and your comments made me think about this, that we call it interoperability just because we don't think it's solved yet. But as soon as we solve it, we'll stop talking about it in terms of interoperability. So I think great points.
Absolutely. So on our way to this end goal, right, as many expect, we're going to run into some challenges, some hurdles. So Alan, I'll stick with you on that, on this one. What are some of the challenges and potential regulatory hurdles that you see over the next 12 to 18 months here?
Yeah, I mean, I think there are a few things. Obviously, there are a lot of challenges, or else we would have already solved it. And so we're trying to work through all of those challenges. And I mean, thinking back, 10 plus-ish years when we were all figuring out meaningful use stage 1, and just trying to get provider organizations to be able to show that they could communicate between each other. There was very little they actually had to do. They just had to attest that they could communicate. And I, being on the EHR side of things at that time, I remember some provider organizations that really didn't want to have to go down this path, because they were concerned that if I open up my system, my competitors are going to steal all my patients, right? And it took a while to get through that challenge, that concern. But now we're at the point that, like, I don't ever hear that brought up anymore. Like, that's not even a concern. Providers know that it's in the best interest of everyone involved to just share information between providers, and we've largely got provider-to-provider exchange for treatment purposes pretty well solved. Again, still things to improve and make utilization better, but we're exchanging a ton of information for treatment purposes between providers. And now we pull patients into the room, and now we pull payers into the room, and now we pull public health authorities into the room. And all of a sudden, we're back to where we were 10 years ago, trying to figure out what is it that both sides are comfortable with? What is it that the payers need? What is it that the providers need to do? And so trying to coordinate now across different types of entities has certainly been a challenge and is going to continue to be a focus as we solve it. The other thing that I would call out on the regulatory side that also makes it difficult is, everything that we continue to do has to largely point back to what is allowed or is not allowed under HIPAA, which is a law that was largely created back when your medical record was a stack of papers in your primary care provider's office in a filing chart. And interoperability meant that someone made a bunch of copies of those documents so that it could be faxed over or carried over or mailed over to the specialist's office or whatever else needed to happen. And that's just not how the world works anymore. We are talking about the electronic exchange of information. We're looking at multi-state health systems that have a single electronic record that they all share. And so trying to figure out how do we then manage all of this moving forward while the regulations are still, frankly outdated and probably need some updates based on the direction things are actually going with the electronic storing of information and sharing of that information.
Yeah, absolutely. Yeah. Justin, throw it over to you from your perspective on this.
Yeah, and I'll just summarize all of Alan's really eloquent comments. I think more so than anything is that I think the first part of your response, Alan, really boils down to trust, right? It's how do we build that trust in everyone? And that's exactly what I think our hallmarks of what Surescripts has done as a network and in partnering with all of our partners, to exchange those 21 billion transactions, as I talked about in 2022, and what we've built within the Carequality framework, right? To be able to get to the point where, last year we exchanged, 1.25 billion record locator and exchange links to those clinical documents. So as Alan said, for the large part, we have ultimately, solved that provider to provider communication, because essentially all of those links to records are all happening in that provider to provider space. But I think Alan brings up a very good point. And again, kind of to summarize that work, and Alan and I were in very similar places when the American Recovery and Reinvestment Act came out, both working in that the electronic health record space to help grow and get providers connected. And I think that, that was a significant challenge, is that just building trust and when something's new, that kind of just baseline change management that needs to happen is part of it. But I think Alan points out some really relevant hurdles in terms of the regulatory space. At that same time in the American Recovery and Reinvestment Act, one of the things we heard a lot from were patients saying, we need to make sure that as this data gets digitized, it's being protected in the right ways. And so there were updates to the privacy rules associated with HIPAA. And those changes were a big deal for healthcare organizations and health technology vendors to be able to accommodate all of the different disclosure requirements and otherwise. But that has built trust, and I think we're going to see very similar things here in terms of the regulatory space. There's some needs to modernize, as Alan talked about clearly, but along with that comes, what are those layers of trust that we need to put into the system at the same time to ensure that we've got a level playing field for folks as it happens, and to ensure that providers, patients, healthcare organizations, and so on all have trust in the system, so that when information is being shared, it's being shared for the right reasons, and we're tracking it, and we know where it is. And these are hallmarks of the things that we've done as an organization for the last more than 20 years, as we've helped to build out the transactions and the network that we curate in terms of our network alliance here at Surescripts.
Yeah, absolutely. So let's move on to kind of the here and now. And Justin, I'll keep it with you here. How are healthcare professionals accessing information now, and what helps to make it richer and more complete? What are some of the elements that elevates this type of data, and what are providers looking for when it comes to accessing this clinical history or clinical data in general?
Yeah, I mean, it all comes down to some of the things we were talking about earlier, but we'll dig into it a little bit more here. Is it's got to be within the workflow for the provider, right? We absolutely need to have the providers and clinicians and other folks in healthcare, just as broadly as possible, accessing the information in effective ways within their workflow, right? And that takes a partnership between all organizations in the process. And to do that, we kind of have to call back to that last answer is we need trust between everybody. And we need to know that the folks sending the data and providing the data are providing the right levels of content. We need to know that the folks receiving it can consume it in those ways and display it to their providers effectively. And so those are significant things that we've seen some really great improvements on. I'll call to some of the work that Carequality and others have done here in the industry as far as talking about kind of a joint task force that we've been part of to say, here's clinical data that's being exchanged. Here's some best practices around it to make sure that we're doing it in an effective way. We've done very similar things here at Surescripts as well, whether it's been looking at prescription information to say, here's quality things that we need to improve throughout it. Or here's specific data requirements that we need to ensure that patients can be identified appropriately and patients can records can then move seamlessly, because we can't move data if we don't have the right information to even identify a patient up front and get that information from one healthcare organization to another. And so I think those things that have happened over the last couple of years, where we've seen the industry really coming together through organizations like Carequality and Direct Trust and through the Surescripts Network Alliance, to be able to say, how can we all agree we need to do better? And when we all do better, we all do better, so to speak, right? And I think those are the main things that have really made those improvements, where we see more records being exchanged with higher quality as we've been doing it.
Yeah, absolutely. Alan, anything you'd like to add there?
There's a lot there, and Justin had a lot of great points. I think, pointing out, I guess, kind of back to the challenge question, but then what makes it more rich and complete, kind of tying all of that together as these questions build off of each other. For anyone listening on the technology side of things, I often joke that one of my favorite things about industry standards is that everyone gets to do them their own way. And because there's a lot of variance in what the standards allow, and I think that gets to that's definitely a challenge in solving these issues, but also gets to a lot of what Justin was talking about, of bringing groups together, solving some of these things. Patient matching. There's not an industry standard for how to do that. Surescripts has done a lot of great work with how it manages things in the record locator, and working with Carequality and others to put best practices in place for how to do patient demographics-based matching. The content of information. We talked about the volumes of information being exchanged, and now we've done a lot of work within the Carequality framework to have best practice recommendations for how to improve the actual content. And so to your question of what makes it richer, more complete information, is getting the industry together to ensure that everyone is following those same best practice guidelines of what is the information that we need, how does it need to be properly codified. Federal government has been doing some great work on that with the U.S. Core Data for Interoperability, USCDI, making it so that the information that's being exchanged isn't just blobs of text that I guess are great, you can read through, but that it's actually usable, computable information being exchanged, so that it is richer and more complete information that then the systems that are receiving it can work with and do things without necessarily needing someone to actually read through all of this text.
Right. Yeah, absolutely. So Justin, let's zero in on a point that Alan mentioned there, which is the technology. So how does technology fit in, and tactically, how does it work?
Yeah. So as we're looking at this, we're looking at it from a technology perspective as a way to rough out or smooth out the edges of what's happening, right? So how can we take the exchange and simplify it is I think the focus of what we want to do there, to ensure that we're using tools to filter information appropriately, right? To use those standards as well in a scalable way. We talk about the volume of information that's being exchanged over the Carequality network and the Surescripts network, but when we talk about that, there's a lot that goes behind the scenes there, and there's a lot of scalability that has to happen from an overall network perspective to support this. And so technology is really important of how can we make things more efficient, how can we make things smarter, so that we're only querying in the right situations, we're only getting that data into the right places. And then it comes down to the usability of those systems that are in front of our providers and pharmacists and patients, is making sure that it is integrated into that workflow, as we've said so many times. So I won't beat that that issue any longer here. But it's really those three different things, where it's how do you take and make things simpler using technology? How do you then make it scalable across the entire country, as we like to look at it when we're talking about our two organizations? And then ultimately, how does it get into the user's workflow?
Yeah, absolutely. Alan, anything from just your perspective as a standards organization, or anything that stands out? I know we've touched on this sort of throughout some of these other questions, but just wanted to give you a chance to kind of tie a bow on this one.
Yeah, and we have talked quite about this through some of the other questions, but to Justin's point about the scalability piece of it, that's really the goal ultimately of Carequality, is to make it so that an organization, whatever type of entity that is, provider, payer, patient, app, whatever, is able just to connect once, and because they're part of the framework, they're able to exchange with everyone else that gets connected. Standard agreements, standard directory management for organizations to know who they can communicate with, et cetera, so that there don't need to be one-off agreements and separate coordination and all of that to make it so that two systems can communicate. They're just able to communicate at scale and continue to expand that out. The impact then of that, as we've talked about, is huge volumes of information being exchanged. And also lots of new types of organizations getting involved that, again, going back to some of the complications with HIPAA and other regulations, are groups that weren't really considered back then. But, we're seeing a lot of, apps and digital health platforms and things that are wanting to get connected. And that's great that this makes all of that information available. It also means that, a provider or a payer or a pharmacist or whoever it is that's accessing information has instant access to way more information than they've ever had instant access to before across all of these different sources of information. And so where the technology becomes incredibly important gets into the workflow stuff that we've talked about, so that the technology that the user is accessing all this information through is properly handling all of that information and putting it into appropriate workflows and deciding what information needs to be presented right to the user versus what can be added into the patient's chart for someone else who needs to see it in the future. Deduplication of information and recommendations and all of these types of things that we're seeing great improvements with what the technology is doing. And I think that's going to be a continued focus of ensuring that the information is usable and consistent, so that the technology can do that, as we're going to continue to add more and more sources of data and need to have the technology handling all of that in front of its users.
Absolutely, that makes a ton of sense. Okay, so let's move on to something that's been fairly popular in the news lately, that HHS and ONC have announced a handful of organizations are moving through the process to become qualified health information networks under TEFCA. So, Alan, I'll start with you on this one. Where do you expect to see the impact of this, and will patients feel the difference?
Yeah, sure, absolutely. And I guess I didn't say anything about that in my intro, but Carequality, part of my role at Carequality also is with TEFCA, the Trusted Exchange Framework and Common Agreement. For anyone that doesn't know that acronym, we like to use acronyms in healthcare IT. And oftentimes we even reuse the same acronym to mean multiple things depending on the context, just to keep it fun. But in this case, TEFCA comes from the 21st Century Cures Act back in 2016. The Office of the National Coordinator for Health IT, ONC, works with the Sequoia Project as the recognized coordinating entity, RCE, and Carequality is also part of that, working closely with Sequoia on operationalizing all of this. So yeah, I've been very involved in the work of TEFCA and the direction that that's going. For those that are following along with things there, it largely comes from what Carequality has already done and proven to be working in the industry. The agreements for TEFCA are largely modeled after the agreements that Carequality implementers sign on to. The initial standards being leveraged by TEFCA are largely based on the same standards that Carequality uses. The directory that these qualified health information networks, the QHINs, will use to exchange information is modeled off of the Carequality directory, et cetera. And so, we're going to continue to see the lessons learned and the improvements from Carequality impact the direction that things go with TEFCA. I think part of the hope and the promise of TEFCA is there are a number of things that in the private sector we've had a hard time completely solving. And really, a lot of that is around some of the cross-organization type sharing of data. Like we talked about, there's a ton of information provider to provider, and that's all pretty straightforward. But now as we pull in all of these other entities who also have interest in getting information, are involved in patient care, have even legal rights to get that information. But it's been difficult to solve some of those things in the past. And the hope there is with some of the direct involvement and sponsorship with ONC involvement, CMS and others also heavily involved in the work that TEFCA is doing, that we'll be able to solve some of those other things. One of those, to your specific question there about how patients will feel the difference, one of those early things that TEFCA is focusing on is ensuring patient access to their own information. That is one of the initial required exchange purposes under TEFCA as we see these QHINs start to get through to designation, and we see exchange beginning later this year. Individual access services, or an individual's own access to their information, is one of those required exchange purposes. And so that is definitely a big focus to ensure that patients have their own information in their own app and able to manage and be following along with and coordinate their own care. And I think we'll see a lot of continued focus on that one in particular moving forward.
Great. Justin, I want to get your perspective on this, obviously from your experience in the industry and where, kind of where we are together here.
Yeah, I mean, I think at the heart of this is Surescripts is incredibly excited and supports everything that the Office of the National Coordinator and Sequoia and the recognized coordinating entity are doing, and as well as it applauds the organizations who have committed to becoming the initial qualified health information networks under the Trust Exchange Framework for the Common Agreement. And I think Alan said it, pretty comprehensively in that, the goals of that program are the goals that Surescripts, I think, has had throughout our existence as an organization, right? We want to see information being exchanged effectively to support, our healthcare providers, throughout the healthcare continuum, whether it's a provider, a pharmacist, somebody, working a claim at a health plan or otherwise. We know folks need access to information and they need it in an effective and efficient way. And that's obviously one of the significant promises, as Alan said, of what the Trust Exchange Framework and Common Agreement have. Where we're at today in time is we don't want to take our foot off the gas. And as Alan said, Carequality is a core component of some of the work that's been going on as it relates to the Trust Exchange Framework. I think, Alan, you maybe described it as testing grounds for some of the work that's obviously happening in the Trust Exchange Framework. And so we're going to continue to push forward and work with our partners in that space, and as well as all of the various other places that we do to enable healthcare interoperability, to make sure that we're continuing to serve our network and our customers as effectively as possible.
Great. All right, so next question here, and we'll finish it out on this, and then have some time, it looks like, to answer some of the questions. So, Justin, I'll start with you. What does the next year look like for both organizations and the technology landscape? Obviously, you can speak, specifically to Surescripts and beyond, and the now, and obviously you to Carequality and beyond.
Yeah, I think the places where we're focusing are on some really specific areas, but then also I think some very large areas. So I'll start with the specific first. I think one of the troubling trends that we're obviously seeing in healthcare is around clinician burnout, right? 1 in 5 physicians are leaving practice because of the challenges that are related to this. And largely the things that we hear from those providers are that it's the administrative tasks. It's not the day-to-day patient care. And so how can we use interoperability to solve some of those problems in really specific ways to better support how we can ultimately kind of change the way medicine is practiced with interoperability, so that those physicians and providers in the communities where they're really needed are not walking away from the profession. I think some of the numbers that we've heard is about 30% of rural hospitals are at risk of shutting down as well. And so when we look at that, not only are we talking about we just have a shortage of folks available, we just don't have the facilities and otherwise available to even serve patients in those rural communities. So those are some of the things that I think we're looking at, as it relates to providers. How can interoperability help to serve those communities? Now, one specific way that I think we've been working, and I think others in the industry obviously have been seeing this as well, is that there's an opportunity for pharmacists in that space. And obviously with our relationships here at Surescripts, we have a great opportunity to help bring folks along in the pharmacy community and otherwise to ensure that they're practicing at the top of their license. And one way to do that is ensuring they have all the right clinical data at their fingertips. So as we talk about what we're doing and the work we're doing in Carequality, or just as a whole as an organization, we're looking for ways to really enable any healthcare clinicians to be able to get access to the information they need to support patients in new and different ways. So when we look at the next 12 months, that's a huge focus. The last thing that I'll say related to this is just continuing to grow. We talk about the big numbers of what the amount of information being exchanged. There are still gaps in getting access to information, and we don't want to see, or we don't want to have these data islands where information is not getting shared to those rural communities, often in many cases, leading to some of these additional challenges that I talked about earlier.
Yeah, absolutely. Alan, we'll finish up with your thoughts on the next year here.
Yeah, great. So, I mean, I think we're going to see a lot of continued discussion throughout the course of the next year on the direction that, we've been talking about here, that things are going, especially with TEFCA. On the Carequality side of things specifically, we've got some exciting policy updates, some technical things that we've been working on for quite a while, and actually just last week kicked off the official process moving through the implementer community for some policies specifically around patient access to information, which has always been allowed, but we're trying to continually improve that. Payer access, specifically in the context of care coordination being done by payers and other non-provider organizations. And then some functionality for some of those apps and digital health platforms that I mentioned before, where they're not necessarily a new provider of care, but maybe an app that a provider is leveraging for additional services, for data visualization or for population health things, and making it easier for providers to use some of these apps in addition to the functionality they get through their EHR, or alongside the functionality they get from their EHR, and also get information easily into those apps to allow those apps to do what they do best. So those are moving through the process right now and are going to be very exciting. to see finalized and published to get organizations moving forward with that functionality. You know, on the industry landscape as a whole, I think TEFCA is going to continue to be a big topic over the course of the next year and beyond, as we see the group of applicant QHINs who were part of the HHS event last month are going to continue moving forward through the onboarding process. Hopefully we'll see some of them designated as QHINs later this year, and others are also moving forward as well. You know, the event last month was really just a point in time for those organizations who had reached a certain milestone at that point, but others are also in the process of moving forward, getting applications submitted, getting through that onboarding requirements. So we're going to continue to see other groups involved and moving forward as well, and also working on things in TEFCA along the same lines of really what Carequality has been working on. Some additional improvements for patient access, payer access, public health is going to continue to be a big focus there. So I think we're going to be discussing a lot of those things continually over the course of the next year as those move forward. And then also additional standards and ways that information is exchanged. You know, a lot of what's exchanged today, again, for those on the more technology side of things, is CDA document-based exchange, which is great, and we continue to improve those documents, and I don't think those are going away anytime soon. But we've also got a big focus on FHIR-based exchange. We actually just, was it just last week? I guess it was just last week, that we, at the IHE/HIM Connectathon, I actually did some coordinated FHIR testing specifically for the purposes of TEFCA rolling out FHIR. But that TEFCA FHIR implementation comes straight from Carequality's FHIR implementation. And so it's also going to have some improvements for what Carequality is doing with FHIR. And Surescripts was actually one of the vendors that was there and participated and successfully validated some of that connectivity to prove out that it will work for both Carequality and TEFCA. We're going to be doing some additional testing of that at the HL7 Connectathon in May, and we're going to see a lot of continued focus on some of those other types of exchange, making it easier for everyone who needs information to access that information in whatever format it exists, and through all these different methods and apps and things like that are coming forward.
I'm going to jump in here, Andrew, before we go to the questions, because Alan, I think, brought up some really great points. And just one of the things that I want to respond to is just to say thanks to Alan and the folks within the Carequality community as a whole, because I think those policy changes that Alan's talking about are incredibly exciting. There are so many different organizations that have wanted to be able to find a way to work within the framework of Carequality, and those policy changes will really allow us to start to expand and to say, this is how we bring that community together as a whole. I think especially in areas of like care management and care coordination, where there's just a significant need, to call back to what I just said around providers not being able to serve some of those communities. Folks find other ways to fill in some of those care goals, or that being able to provide care to patients, and care management and other programs like that really start to fill some of those gaps. And we're going to need to make sure they have the right information, otherwise they won't be able to be effective. So really excited about that. And I appreciate Alan bringing up kind of that transition into the FHIR world. I think another piece of my answer that I missed that I probably should have talked about was specific to that, the kind of to go back to one of our earlier questions, the technology and how does it work? Well, there are many folks and many organizations at very different places in terms of what that technology is. And a role that Surescripts really envisions themselves is playing that intermediary to help support folks wherever they are in the journey, right? To meet them where they're at, if they're exchanging clinical documents, to help support how they might be able to fit into that FHIR world as early as possible. And for those folks in the FHIR world, how they can ultimately communicate with folks in that document-based exchange world is something that we've been working towards for many years, and are excited to help play that role to ensure that maybe if we aren't all meeting in the exact same place, we're close enough that we can make data and information get shared effectively.
Great, absolutely. So, okay, you've answered all of my questions. So now we're gonna we're going to transition to some audience questions. So again, feel free to keep submitting those. We've got a couple here, and looks like one more even since I mentioned it. All right, so this one really is open to I would say either of you, but who are the key players when it comes to advancing interoperability, and what stakeholders have the most influence to advance interoperability? So Justin, if you want to start from your just perspective, and then Alan, from maybe a more global perspective, obviously working with a lot of these stakeholders as well as us at Surescripts.
It's clearly Alan and I in terms of no, I mean it's really everyone. That's one of the big pieces here that I hope we've seen throughout the conversation is we need to bring everybody together, and that's exactly what, as I've said a couple of times, what Surescripts wants to be able to do. We need to be able to build the tent bigger, so to speak, in that Carequality framework, so that we're bringing in these other organizations so that we can start to ensure that data gets exchanged to all of them, right? Whether it's the health plan community, the care management organizations, or otherwise. I don't know that there is one group that I can point to say, like, they're going to solve it for us. We all have to solve it together. And if we don't, the things that we talked about earlier in terms of that trust and ability to exchange information just will never happen, because if everybody doesn't have a say, or the stakeholders aren't at the table while we're talking about it, it's not going to happen. And so sorry to shirk, I think, giving an answer on this one, but that's the way I see it.
Yeah, and I'll just jump right there. I mean, I completely agree with Justin's answer. I think that, we've kind of talked about this a little bit through some of the other questions, but we've done so much work with provider to provider exchange because it's largely been providers and their vendors at the table. And that's because of, previous regulations and incentive programs and things like that were all focused on providers. And so it made sense. There was a problem there that needed to be solved. The then effect of that moving forward to now 2023 is that we still mostly have providers and their vendors at the table, as we're now trying to figure out how to get better access to payers and patients. And if they're not the ones at the table, and we've just got a bunch of providers and their vendors trying to figure out how to handle this, well, it doesn't quite work. We need to make sure that we've got the payers at the table to talk about how payers want to access information, what information they want to share. We need to make sure we've got representatives of patients at the table and patient apps to figure out how patients want to be able to access information and see that information. Even in the clinical side of things, there's difference between specialties and clinician versus a pharmacist and the information that they need to see. And so I completely agree with Justin's answer that there really isn't necessarily a single organization per se that is the key player that's going to solve everything. But we really need to make sure we've got representation across the entire healthcare ecosystem at the table so that we can jointly solve these issues in a way that satisfies what everyone needs access to.
Yeah, absolutely. Okay, Justin, this one is certainly a little more specific to you and us, I suppose. So is Surescripts trying to replace Care Everywhere, or will it work in conjunction with Care Everywhere?
Oh my, no, we're certainly not trying to replace Care Everywhere in that environment. We barely build tools and things that work with our partners, and our partners include health systems and providers and our electronic health record vendor community, and we're certainly not trying to replace any of the great work that they do, because we ultimately need to work within the framework of all of those different partners to ensure that information is being exchanged effectively. So we're certainly not trying to replace anything. We want to supplement and add to any of those vendor kind of community exchanges that are occurring, within the vendor community as a whole.
Yeah, absolutely right. Putting that larger umbrella over something that's already happened versus trying to interrupt it.
Yeah, absolutely. We do not want to take steps backwards in any way, shape, or form as we talk about any of this stuff here today.
Yep. Okay, so I'll open this one back up for both of you again here. But so besides HIPAA, which we talked about, what are the biggest blockers in advancing interoperability?
Well, I mean, I'll jump in. I think, HIPAA is definitely a big one on the regulatory side of things. And there are other changes that have been made over time to clarify what's there and kind of put some, Band-Aids on top of stuff to make sure that it makes sense as things move forward. And there are, even recent, regulatory changes and requests for comments around, changes to like 42 CFR Part 2 data. Which is also a pretty big, complicated thing when we start talking about that in the context of information exchange, and probably could be an entire webinar on its own. So there are a number of other things that are related to all of that. There's information blocking, which also comes from 21st Century Cures Act, is a new and exciting thing that we're still waiting for some additional clarification from CMS and OIG and others on what that is really going to mean, and the penalties and who's impacted by it. There's just a lot going on the regulatory side of things that are certainly challenges. But then again, just within the industry as a whole, to the points that we've kind of talked about, the making sure that we've got everybody involved and at the table is and continues to be a difficult a challenge in solving interoperability, making sure that those who need the information are the ones who are helping us figure out how to share that information appropriately for their use. And then, just looking at all of the different, standards bodies that are available and creating all of these different standards, and that's all great, but making sure that we're then coordinating things between them so that we don't just have so many different standards that nobody can agree on which one is actually the best way to do it. So a lot of it, I think, is really just coordination within the industry of ensuring that we're all on the same page and working toward the same goal and solving the same problems together across everyone who needs to be involved.
Yeah, absolutely. Okay, so we do have a couple more, and looks like we're obviously inside of 10 minutes here. So I'll move on to the next one here, which is give some, and Justin, feel free to jump in here, give some examples of some of the best practices that you have in place that will give a provider the confidence to trust the exchange of information. We've talked about, I think, both of those things, right? Both confidence or trust in the information. So anything to point out that you've seen resonate with providers?
And can you hear me all right? I think my video might have frozen.
Yeah, you froze for just a second, but seems like you're okay.
Perfect. All right, just making sure. I think, to Alan's point before, trust is incredibly important in that overall picture, and I know we mentioned that before, but so this is a perfect follow-up question, Andrew. The things that I have seen as we've been implementing this and we've been working with our providers and other partners is that there needs to be consistency. And when I say that, I'll use a little bit more specifics. Is when I push the button, so to speak, to go get information, that information is returned, and I'm able to see it every time, and I see that it's consistent. Because without that level of just repetition to it all, it's very hard to trust in any of those things. And I can give you an example of this as we go back. And this actually is through the direct messaging world. It's something that I did a couple of years ago. Is we started to send immunization notifications working with some of our partners through direct messaging. And we'd send those electronically. And when providers first started receiving those messages, they said, what the heck? I don't know what to do with this. I don't have any way of dealing with it. But to with a lot of work, we started to say, well, this is what we're doing. We're sending you this immunization that happened in the pharmacy. The patient got their flu shot, right? You want to know that, so you're not giving them another flu shot. And so we worked with our vendors and our other partners to say, how do we ultimately make sure that that information gets into the right place at the right time? And now today, I get phone calls on the other end of that saying, hey, this immunization showed up as a fax. It should just automatically get into my system and show up on their chart so I don't have to think about it. And that's the type of activities that have to happen to instill that trust. It is really the way I look at it. Hopefully that's a good example for folks.
Yeah, absolutely. All right, we've got a few more, but I'll throw in one wild card now because so obviously we can, take this as it is and where we are now in the world. But in the world of AI, how do you think Chat GPT, language models, et cetera, will play a role in healthcare, and in any way related to obviously some of the interoperability challenges we're talking about today?
Sure, I'll start on that one. So this is an interesting one, and I think the answer really is, things are just changing and evolving so quickly that it's really hard to predict what's going to happen. We talk about all these different standards and the next big thing, and everyone expected that fire would solve all of our problems, and it really hasn't yet. So then blockchain was going to solve all of our problems, and now it's going to be AI that solves all of our problems. I don't think there's going to be a single solution that actually solves all of our problems, but all together they'll continue to make improvements. AI is an interesting one, especially thinking back on some of the regulatory stuff and some of the apps and things that are coming forward that are really focused on AI, like on the Carequality side of things. We do a lot of work with some of these vendors that are getting started and coming forward and proposing what they want to do and seeing if it makes sense for them to participate. And we're seeing a lot more of these apps that are primarily AI based, which raises all sorts of interesting regulatory questions of, is it really treatment under HIPAA if the treatment was actually provided primarily by AI? If you've got an app, for example, that gathers outside information and then tells the patient what they need to do based on AI analyzing all of that information, was that treatment? Or how much does a provider actually have to be involved? And in a lot of these cases, we do still see provider involvement. So don't go worrying too much about it. But there's, as we're seeing clinical decision support, even, I think is something that everybody here is probably familiar with, is becoming more and more, focused on, machine learning and AI and all of these things, to have the system make recommendations that the provider then reviews and acts on. And it opens up this interesting gray area where we're going to have to figure out how much does the provider have to do for it to legitimately be treatment versus how much the computer did and told the provider what to do. And who's at fault then if the provider makes a decision based on something the AI told them was the best thing to do? And I don't have the answers to all of that, but I think that we're going to AI in healthcare as a whole, and also in the exchange of and access to information. And it's going to be exciting as we continue to solve all of that.
Yeah, I'll throw a few thoughts in here as well. It's just that there's obviously immense potential to what AI and other things can do, as Alan described. I think where we need to be at still in this moment is staying focused on what are our next steps. We know that there's no shortcut to exchanging information. We know that there's no shortcut to improving workflows. We still need to do the hard work of how do we get everybody to trust each other as human beings first, before we ultimately can trust that we can go into that type of an environment where there are more and more technology tools layered on top of this to give recommendations at first, or even provide specific information on treatment plans and otherwise. And so I think there's obviously tremendous potential. There's going to be a lot of great, really, really cool things that are going on in this space, whether it's related to interoperability specifically, or really that interaction between the provider and the patient, or maybe removing providers in certain cases. I don't know, but there's a lot of steps that we need to get to before we get to that place to instill trust and ensure that the information is even available for those tools to use it effectively as they become and are developed.
Yep, great. Okay, so let's close out on this one. It's a kind of a two-part question. How do small healthcare organizations get involved in TEFCA, and also how can they work with Surescripts for interoperability? So I'll I guess start with you, Alan, on the TEFCA question, and then any other feedback there for our final question.
Yeah, absolutely. And I would say, everyone here definitely has a place in TEFCA. It's intended for, regardless of how big or how small, which I sound like Dr. Seuss there, gave me some thoughts back to Horton Hearing Who. Regardless of how big or small you are, you've got a place in TEFCA. And, I think that the technology will definitely have an impact there. The purpose of having QHINs is to have some networks that are able to ensure connectivity between each other and then provide that connectivity down the line to their participants and sub-participants, et cetera. But for every, healthcare provider, or again, payer, patient, public health, everyone else that should be involved in exchanging in this ecosystem, it's really going to be looking about what are the technological capabilities that you have, and then who is it that makes the most sense for you to work with to connect into this ecosystem, right? You don't necessarily have to be a vendor that fully supports all of the various industry standards and knows all of the acronyms to be able to participate, if you work with someone who is able to handle that translation between standards and things for you. And really that's how TEFCA is intended to be set up, is that there's a place for everybody. And then you just need to work with your chosen vendor to make sure you have the appropriate connectivity to then be able to exchange across the entire ecosystem.
And I can wrap it up real quick and just
please.
say, if you want to work with Surescripts on any of the things that we've talked about, a great place to start is just heading out to our website, surescripts.com. Our contact us link there allows you to put in all of your information, and that goes to a great group of folks on our account management teams that'll filter it into the right place depending on the interoperability services you're looking for.
Great, absolutely. All right, well, thank you both so much for your time, and thank all of you in the audience for your time. We are right at an hour here, so I think we hit it just right. Really, really appreciate all the great conversation and questions that were asked. So thank you all, and of course, thank Modern Healthcare for hosting this and taking care of all the logistics, and look forward to speaking more on this topic in the future.
Yes, thank you. Thank you, Andrew, Justin, and Alan, for this wonderful presentation. And we'd once again like to thank the sponsor of today's webinar, Surescripts. For more information about Surescripts, please visit surescripts.com. And to our audience, we value your time and feedback. Please take a moment to fill out the post-webinar survey, and a copy of today's presentation will be sent to your email following the event. Thank you, everyone, and have a great day.